Every action matters when it comes to protecting yourself and your loved ones from COVID-19. As coronavirus cases rise across the country, maintaining social distancing and wearing a mask have become unavoidable. However, there is one more factor that plays a very crucial role in stopping the transmission of this deadly virus: ventilation. The government has said that aerosol particles containing COVID-19 virus can travel up to 10 meters. Keeping this in mind, the government has introduced new easy-to-follow guidelines to stop the transmission of the virus and crush the pandemic. The government in its guidelines has suggested ways to improve ventilation and reduce the chances of COVID-19 transmission. Just as you can get rid of a bad smell by ventilation, the dangerous concentration of the virus can also be reduced by ensuring that outdoor air flows in. The recent guidelines issued by the central government say that the placement of a fan is crucial, as the fan should not be at a place where it can cause contaminated air to flow directly to someone else. The guidelines suggest if the windows and doors of a room are shut, the exhaust fans should keep running. Now, how does this help? Exhaust fans can help pull bad smell or fumes outside of the room and vent it outdoors for removal. Now, this in the case of COVID-19 can help create the required airflow for maximum protection from an indoor infection. The guidelines say that lack of windows or lack of cross ventilation increases the chances of infection inside a poorly ventilated space. Now, why are these guidelines important now? The government has said that some infected people may never show any symptoms or signs, but can still release enough droplets to create a viral load that can be dangerous for others and infect them. Saliva and nasal discharge in the form of droplets carry the virus from one person to another. Sometimes these droplets fall to the ground and on surfaces, and smaller particles are carried in the air to greater distances. These smaller particles can linger in the room or in the air. In closed, unventilated indoor spaces, droplets become quickly concentrated and can increase the risk of transmission to people in the area. Now, what about ventilation at workspaces? Well, the government guidelines say that keeping air conditioners on while keeping windows and doors shut can trap infected air inside the room and increase the risk of transmission from an infected carrier to other people. Therefore, it is advised to keep windows and doors at least half or partially open while the air conditioners are running to bring in clean air. For places that use centralized air management systems like malls, offices, auditoriums, roof ventilators are recommended that must be regularly cleaned or replaced. Now, how can we ensure proper ventilation in public transport? The guidelines say that there must be cross flow of air in public transport vehicles. Windows should be open in buses and trains, and introduction of exhaust systems to improve airflow in air-conditioned buses and trains can also be helpful. It is important to ensure proper ventilation at hospitals as well. The government says that hospitals and health centers must ensure that vaccinations are carried out in well-ventilated areas. Remember, earlier this month, the World Health Organization, or the WHO, had included the possibility of airborne transmission of COVID-19 in an indoor or non-ventilated setting. If each one of us continue doing our bit, we can definitely keep the deadly virus at bay.